She is about less than a year old. Just before her first birthday, parents got a news that she had got a big bone tumor in the thigh. I mean, of course, this is a shocker for anybody. She comes from a village near Mangalore, Sarpadi. When I got a reference from a very hospital nearby, and I went and saw, it was a shocker for the whole parents. So once we got this news, and I spoke to the parents that, look, it's a 1-year treatment and we have to do the best in the world. That was my goal. All the time, I always tell, including my team, we have to think whatever is the best in the world has to be given to every person in the society.
ಮಗುವಿಗೆ ಗೊತ್ತಾಗುದಿಲ್ಲ, ಮಗು ಅವಳಷ್ಟಕ್ಕೆ ಇದ್ಲು, ಮತ್ತೆ ಅವಳಿಗೆ ಫುಡ್ ಎಲ್ಲ ಟ್ಯೂಬಲ್ಲಿ ಹೋಗೋ ಕಾರಣ
ಬರುವಾಗಲೇ ನಮಗೆ ಸ್ವಲ್ಪ ಅವರು ಬರುವ ರೀತಿಯಲ್ಲಿ ಸ್ವಲ್ಪ ಪಾಸಿಟಿವ್ ನಮಗೆ ಬಂತವರು. ಅವ್ರು ಮಾತಾಡುವ ಸ್ಟೈಲಲ್ಲಿ ಎಲ್ಲ ನಮಗೆಲ್ಲ ಒಳ್ಳೆ ಒಂದು ಡಾಕ್ಟರ್ ಅಂತ ಹೇಳಿ ನಮ್ಮೊಂದು ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ ಆಗಿ ನಮಗೆ ಮಾತಾಡಿದಾರಲ್ಲ ಸರ್ ಬಂದರು. ಒಳ್ಳೆ ನಮ್ಮ ಮನಸ್ಸಲ್ಲಿ ಟೆನ್ಷನ್ ಇತ್ತು, ಸ್ವಲ್ಪ ಒಂದು ಅವ್ರು ಮಾತಾಡಲಿ ಸ್ವಲ್ಪ 30% ನಮಗೆ ಸ್ವಲ್ಪ ನೋವು ಕಮ್ಮಿ ಆಯ್ತು, ಸ್ವಲ್ಪ ಮಾತಾಡುವಾಗ ಟೆನ್ಷನ್ ಎಲ್ಲ ಕಮ್ಮಿ ಆಯ್ತು.
Once the chemotherapy is started, so we have our child in our control. The tumor is in the control. So my friend Harsha started the chemotherapy in Mangalore. So meanwhile we were preparing for the surgery, and the biggest challenge is one is type of surgery, and number two, the cost of surgery was too prohibitively problems. Type of surgery, because 1-year-old child in any part of the world, this area of the tumor end up in having amputation, that means removal of the leg, which I personally, my philosophy does not believe in 2024 or when we treated it in 2020. My boss, Dr. Manfrini, has treated such children, a couple of such children, I would say in single digit, where we have transplanted somebody else's bone, that is an allograft, somebody else who's dead, their bone has been transplanted to the patient's hip joint and made the patient walk. For this child, we plan to use a shoulder bone for the hip bone, because shoulder bone size is matching a child's hip bone, because the bones which are donated, like eye donation, has to be brought from Italy for her. So that had a lot of consequences. Number one, costing. Number two, COVID.
ನೀವು ದೊಡ್ಡ ಡಾಕ್ಟರ್ ಇದು ಮಾಡ್ಬೇಕಂತ ಹೇಳಿದ್ರೆ ನಮಗೆ ಟೆನ್ಷನ್ ಆಯಿತು, ತುಂಬ ಟೆನ್ಷನ್ ಆಯಿತು. ಅಂದರೆ ನಮಗೆ ವಿಷಯ ಗೊತ್ತಿಲ್ಲ ಏನಂತ. ಆಮೇಲೆ ನಾವು ದೇವರದೇ, ನಾವು ಅಮ್ಮನ ಎಣಿಸಿದ್ರು, ನಾವು ಕಡ್ಡಿದುರ್ಗ ಪರಮೇಶ್ವರಿ ಅವರನ್ನೇ ಎಣಿಸಿದ್ರು ನಾವು.
ಒಂದು 4 ಸೈಕಲ್ ತುಂಬ ಕಷ್ಟ ಆಯ್ತು ಅವಳಿಗೆ. ಅಂದರೆ ವಾರದಲ್ಲಿ ನಾವು ಮನೆಗೆ ಬರೋದು, ಹಾಸ್ಪಿಟಲ್ಗೆ ಹೋಗೋದು, ಅಲ್ಲಿ ತಿಂಗಳ ಅಡ್ಮಿಷನ್, ಮತ್ತೆ ಎಲ್ಲ ಅವಳದು ಪ್ಲೇಟ್ಲೆಟ್ ಎಲ್ಲ ಡೌನ್ ಆಗೋದು, ಏನೋ ಕಂಡೀಷನ್ ತುಂಬ ಅಂದರೆ ತುಂಬ ಕ್ರಿಟಿಕಲ್ ಐತಿ. ಅವಳದು KG 8 kg ಅಷ್ಟೇ ಇದ್ಲು ಅವಳು. ಅಂದರೆ ಚಿಕ್ಕ ಒಂದು ಏನೋ ಹೀಗೆ ಕೈಯಲ್ಲಿ, ಒಂದೇ ಕೈಯಲ್ಲಿ ಅವಳನ್ನು ಅಷ್ಟು ಇದಿದ್ದು.
We did a crowdfunding and organized about 25 lakh, that's about 2.5 million rupees in say about a month and a half time. All thanks to my friends, family, and to be honest, one of the most important person who was spearheading this crowdfunding was one of my old patient, who unfortunately she is no more. She is a nurse, and her friend, they were the backbone in raising the funds. We raised about 25 lakh rupees and made sure that money part was taken care of the child. Then came the challenge of shipping the bone from Italy to India. Everybody says when you want to do something important, the universe will help you. The same way, we got a child from Oman, which needed a similar procedure. Even this bone was shipped. So it is like the shipping cost was taken care. Likewise,
ಅದು ಪ್ರಾಬ್ಲಮ್ ಅಲ್ಲ, ನೀವು ಟೆನ್ಷನ್ ಮಾಡಬಾರ್ದು, ಅದು ಏನಿಲ್ಲ ಅಂತ. ಪ್ರಾಬ್ಲಮ್ ಇದ್ರೂ ಕೂಡ ಅದನ್ನು ಅವರು ಆ ಥರ ಮಾತಾಡ್ತಾರಲ್ಲ, ಆ ಥರ ಇವರು ಪ್ರೊಫೆಸರ್ ಕೂಡ ಇದರಲ್ಲಿ ನಮಗೊಂದು ಪಾಸಿಟಿವ್ ಬರ್ತದೆ ಅಂತ ಮಾತಾಡುವಾಗ.
ಚರ್ಚಲ್ಲಿ, ಮಸೀದಿಯಲ್ಲಿ, ಟೆಂಪಲಲ್ಲಿ ಎಲ್ಲರೂ ಪ್ರೇ ಮಾಡಿದ್ದಾರೆ. ನಮ್ಮ ಊರಲ್ಲಿ ಕೂಡ ಒಂದು ಮಸೀದಿ ಉಂಟು, ಅಲ್ಲಿ ಕೂಡ ತುಂಬ ಎಲ್ಲ ಪ್ರೇ ಮಾಡ್ತಾ ಇದ್ರು ಎಲ್ಲರೂ ಹೋಗಿ, ಊರಿನವರೆಲ್ಲ ಎಲ್ಲರ ಸಪೋರ್ಟ್ ತುಂಬ ಇತ್ತು.
early morning about 7 we started the surgery, and we first started the surgery on the bone we got, not on the patient, because that will cut down the patient's anesthesia time. Prepared the bone, the allograft or the dead bone with the prosthetic, made that thing ready before even starting the patient's body surgery. So once the patient was anesthetized, we did the surgery for about 6 to 8 hours, and the bone along with the implant was implanted, and the surgery went on uneventful. And the patient, the child, she never smiled till last day of the discharge. Last day she smiled at me. I don't know how, but that is a really that feeling is still. I can see that the mother also was telling. This is the first time she smiled at somebody after so many days. But anyway.
ಮತ್ತೆ ಇದರಲ್ಲಿ ಏನು ತೊಂದರೆ ಆಗಲಿಲ್ಲ, ನಮಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಎಲ್ಲ ಒಳ್ಳೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಕ್ತು. ಮೇನ್ ಅಂದರೆ ಸಾರದೊಂದು ಒಳ್ಳೆ ಅವರೊಂದು ಅವ್ರು ಮಾತಾಡೋದು ನಮಗೆ ಸ್ವಲ್ಪ ಒಳ್ಳೆ ಇದಾಗ್ತದೆ. ನಮ್ಮವರ ಮನೆಯವರಾಗೆ ಟೆಕ್ಷನ್ ಬಚ್ಚು ಮಾರ ನಮ್ಮ ತುಳಲೆ ಮಾತಾಡ್ತಾರೆ, ಟೆಕ್ಷನ್ ಬಚ್ಚು ಮಾರ ಯಾವ ಲೆತ್ತ, ಅದು ನಮಗೊಂದು ಅವ್ರ ಪ್ಲಸ್ ಆಗ್ತದೆ. ಈಗ ಅವರ ಫೋನ್ ಮಾಡುವಾಗ ಹಾಗೆ ಮಾತಾಡ್ತಾರೆ ನಮ್ಮ ಮನೆಯವರಾಗೆ.
For the record, this was the first child in India to be walking on the man-made hip joint. And such things have happened in the world, even in a very low numbers, like singular digit numbers, conceptualized by Dr. Manfrini. The wound healed well, she started walking. She used to send me pictures of the videos of she playing around. When I used to get heart attack, when she started toppling around, playing around like a child. But in the hip joint, I've seen it growing over the last 3-4 years, and you should see the way the nature helps in healing and making the bone so longer and so better.
ಮತ್ತೆ ನಾವು ತುಂಬಾ ಆ ಟೈಮಲ್ಲಿ ನಾವು ತುಂಬಾ ಹರಕೆ ಹೊತ್ತಿದ್ದೇವೆ. ನಾವು ಇದು ಕೂಡ ಆ ಹರಕೆಯನ್ನು ಕೂಡ ನಾವೀಗ ತಿರುಸ್ತಿದ್ದೇವೆ ನಾವಾಗ. ಮತ್ತೆ ಎಲ್ಲ ಅವರ ಅಮ್ಮನ ದುರ್ಗಾ ಪರಮೇಶ್ವರ ಅಮ್ಮನ ಕಟ್ಟಿ ದುರ್ಗಾ ಪರಮೇಶ್ವರಿ ಅವರ ಅಮ್ಮನ.
She danced for about 2 hours. We call it Pilivesha in Mangalore. So I think she danced for 2+ hours non-stop. So that is the video I really made me, think that the whole process was worth it. And fortunately, God willing, she does not have any disease, and hoping that she will achieve greater height.
ಶಾಲೆಯಲ್ಲಿ Sridevi, she is like a little angel in our school. Feel that she is excellent in every aspect, especially the dance, going perform on the stages and all other activities. Not only that, she is a lovely kid because she mingles with all children, especially whenever we are there, she just comes and hugs us, and I can say that she is a very loving kid and excellent in her studies, picking up the rhymes, storytelling and everything. She is doing very well. Another day we had conducted some competition for the school day, and she has won the prizes. That's what I want to tell about her.
This is our 15th year. We have treated more than 8,000 to 9,000 bone tumor patients with world-class outcomes. And using the technologies of 3D printing, it could be allograft bone banks, or it could be IoT. We have 5 engineers who are helping with us. That's how I think cross-specialization has helped our Eloriban to achieve these scales.
ಅದೊಂದು ರಿಪೋರ್ಟ್ ನೋಡಿ ಅಂತ ನೋಡ್ಬೇಕಂತೆ, ಅದು ಅವಳಿಗೆ 100% ಕ್ಯೂರ್ ಬಂದಿದೆ ಅವಳದು. ಅದು ಭಾರಿ ರ್ಯಾರ್ ಅಂತ ಹೇಳಿದ್ರೆ, ಯಾರ್ದು ಬರುವುದಿಲ್ಲ. 80%, 90% ಎಲ್ಲ ಬರ್ತದೆ. ಇವಳದು 100% ಕ್ಯೂರ್ ಎಲ್ಲ ಬಂದಿದೆ ಫೈನಲ್ ರಿಪೋರ್ಟಲ್ಲಿ. ಈಗ ನಾವು ಹೋಗ್ತಾ ಇದ್ದೇವೆ, 3 ವರ್ಷ ಆಯ್ತು ಈಗ ನಾವು ಅಲ್ಲಿ ಟೆಸ್ಟಿಗೆಲ್ಲ ಹೋಗ್ತಾ ಇದ್ದೇವೆ. ನಾರ್ಮಲ್ ಇದೆ, ಇನ್ನೆಲ್ಲ ಟೆಸ್ಟ್ ಎಲ್ಲ ಕಡಿಮೆ ಮಾಡ್ಬೇಕಂತ ಹೇಳಿದ್ದಾರೆ. ಟೆಸ್ಟ್ ಎಲ್ಲ ಆಯ್ತು ಅವಳದು, ಎಲ್ಲ ನಾರ್ಮಲ್ ಇತ್ತು. ಮತ್ತೆ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಕೂಡ ಪ್ರಮೋದ್ ಸರ್ ಟೀಮ್ ತುಂಬಾ ಸಪೋರ್ಟ್ ನನ್ನ ಹತ್ರ ಫೋನ್ ಮಾಡಿ ಎಲ್ಲ ಕೇಳ್ತಾ ಇದ್ರು.
ಟೆನ್ಷನ್ ಇತ್ತು, ಆದ್ರೂ ನಮ್ಮ ಅಮ್ಮನ ಧೈರ್ಯದಿಂದ ಮತ್ತೆ ಡಾಕ್ಟರ್ ಇವರಿಂದ ಒಳ್ಳೆ ಇಲ್ಲಿಗೆ ಇಷ್ಟವರೆಗೆ ಬಂದಿದ್ದೇವೆ ನಾವು. ಡಾಕ್ಟರ್ಗೆ ತುಂಬಾ ಥ್ಯಾಂಕ್ಸ್.
This is an example of what we can do as a single person or a smaller organization. Imagine if everybody has got this kind of a thought flow and deep work, for sure we can create wonders. That's about Sridevi. Thank you.